So we're going to talk about what we consider one of the most important things after knee replacement surgery, and that's what we call a knee extension. Knee extension is your ability to get your leg completely straight. A lot of times if you've had issues for a long time and it's been a while since you've had pain or arthritic conditions before your surgery, a lot of times you can't get completely straight anyway. However, one of the things we would say is if you cannot get your knee completely straight, you're never going to walk normal. So immediately after surgery, that's one of the very first things that we can start working on, especially because you've had some anesthesia, a lot of times a pain block, and it's not very painful. So we want to work real hard from the minute you get home, immediately. We do that by positioning. So most of the time people are seated in a chair, maybe a recliner, and they get themselves comfortable, and that's totally fine. So pretend I'm in a recliner here and I have my legs straight and propped, and most people think this is good enough. However, one of the things you'll see and kind of see it down the side of my leg is my thigh is supported by this chair, my lower leg is supported by this chair, or be that an ottoman or a leg rest on a recliner. But usually that portion that's past my knee has a downward incline. And so that actually allows my knee to bend just ever so slightly, maybe 5 or 6 degrees. But that's the difference in a successful, quick outcome with knee replacement and something that is long and painful is getting that last 5 degrees. So we get home immediately after surgery. The very first thing that we want to start doing is propping our leg in a way that has no support at all from mid thigh on down to almost around your ankle. So when I'm like that, now gravity can take my knee and kind of press it down just right here. There's no way that I can relax with that bent. So the big key to it though is not only from this position, but also keeping my foot straight up and down. You can't quite see it from the view of the camera, but most people tend to let their foot point out, or their toes kind of go towards the northeast. If you're looking at a compass, we want to position so that our foot is straight up. A lot of times I'll take a towel and roll it up and put it by the patient's thigh, and that'll keep it from rolling out. So we'll just kind of roll it right here, or we can prop a pillow or something with it. But ultimately, there's nothing supporting between kind of mid-thigh and down around our ankle. So if you're in a recliner, like what we were talking about, I'm trying to make this work like a recliner here. So if I'm in a recliner like this right here, it feels like I'm straight. What I've got to do is put 2 or 3 pillows under my leg right here so that I lift it up, and then I meet that requirement of there's nothing supporting the leg between down here by my ankle and mid thigh. So if you'll do that from the get-go, so the minute you get home from surgery and you're sitting around, I usually tell people to start doing it at least 5 to 10 minutes every hour. It's not very painful those first couple of days, so do it. If you'll get that range of motion from the get-go, you won't have to work so hard to get it later on.